CCS 101.1 FM, AM 1160, and you can join us on Facebook Live and watch this segment if you'd like with Dr. Lanvin Taylor from the IRMC Physician Group. It's our Meet the Doctor segment. We've met you before, but it's good to catch up with you again. Good morning.
Good morning. Good to be back.
Yeah, it's good to have you here today. Hey, May is Stroke Awareness Month.
It is.
And obviously, as a physician, that is something that concerns you and should concern all of us. Stroke prevention, stroke treatment, what happens when you feel you're having a stroke, all of that becomes a part of the discussion, and especially that discussion is increased during the month of May. It's good to call awareness to all of the issues surrounding stroke, isn't it? Definitely.
Leading causes of death and morbidity in the country are heart disease, cancer, and stroke. If I could make one plug for, if you could do one thing today that would overall reduce your risk of stroke and, a number of other diseases out there, would be to quit smoking. Smoking is probably the number one modifiable risk factor for stroke that we can stop. Basically, cigarette smoke, nicotine, beats up your blood vessels and makes you predisposed to having a stroke.
Yeah.
On top of that, age, we can't make you any younger. I wish we could. If I do figure out how to do that, you'll never see me again. But, in talking about stroke, I would like the people out there to understand that don't wait. If you start to notice symptoms of a stroke, which include difficulty speaking, garbled speech, weakness on one side of the face or body, seek treatment immediately because, every minute that is a delay is, brain loss we're talking about here.
Yeah.
In talking about what a stroke is basically a compromise of blood flow to the brain. So, if you think about, you need blood and, the blood feeds the brain with oxygen, nutrients, and things like that. So, very important to seek help immediately, get to an emergency room. Don't wait for the symptoms to go away.
I was going to ask you, what physically is happening inside your body when a stroke occurs?
Correct. So there are different types of strokes, but to keep it simple, there's a part of the brain that is not getting fed the appropriate amount of blood that it needs. Sometimes that happens because there is a blockage in a vessel. And so anything that's past the blockage basically gets strangled. Sometimes there can be because there's not enough blood getting there because there's a burst of a vessel and everything past the burst doesn't get blood flow. But essentially a lack of blood flow to parts of the brain. And then once the brain doesn't get blood flow, parts of the brain start dying.
Yeah. And so that's what's happening. And you mentioned how essential, absolutely essential it is to get treatment as quickly as possible.
The other part of seeking treatment immediately as possible is that there are certain treatments that we can do and interventions that are time sensitive. So, within a certain window, we're able to give you these things called clot busters. Within a certain window, we're able to go in sometimes and do procedures that are endovascular, where we can actually go into the blood vessels and remove the plaques, almost do like a rotor-rooter type of thing or a plumbing snake, in the blood vessels to help. And then we restore blood flow to that part of the brain that has been compromised. So, very important.
And obviously reversing the effects of a stroke would be dependent upon how quickly you're able to treat it.
Correct.
Yeah. And so let's talk about that, reversing the effects of a stroke. You can get full functionality back if you get there in time and everything works out the way that you wish.
Yeah, correct. So what initially happens is if you just think about if I were to put a tourniquet around my hand, first my fingers would go numb. Then they would get weak. But if I remove the tourniquet in time, or if you've ever had your arm fall asleep, sensation and strength and function comes back. So that is, key to getting in there and having, and so at one point the brain is just kind of stunned. And if you get blood flow back to it, you don't lose any, brain tissue or brain cells, so to speak. But at some point, if you delay or waiting too long, or if it's just a big stroke, you begin to lose those key parts of function.
Yeah. There's a term out there, mini stroke. Someone had a mini stroke.
Correct.
Explain that.
So mini stroke, a synonym for that is a TIA. It's where there's a transient or temporary compromise of the blood flow that returns. So why that's important is it's almost like a harbinger or a sign where if you're having mini strokes, you're more predisposed to have an actual full-blown stroke later in life. So with those type of patients, we recommend, first of all, I have to plug for wellness and checking up with your primary care physician and making sure that you're addressing risk factors for stroke, including, like I said, stopping smoking, hypertension, diabetes, and just overall taking good care of yourself. But yeah, those people, we want to make sure that we have you on appropriate medical management and a regimen that's going to do the best to prevent, full-on stroke.
Dr. Lanvin Taylor is with us, the IRMC physician group. We're talking about May being Stroke Awareness Month and the risk factors, the prevention steps you can take, what you should do when you feel you're having a stroke, or when you come upon a family member who you think might be having a stroke, all of those things. IRMC is a primary stroke. Give me the correct terminology for what IRMC is in terms of its stroke program. Primary Stroke Center, or yeah, that's what it is. What does that mean? What are the steps that IRMC can take that maybe others who don't have that designation cannot?
Well, we're able to treat stroke, aggressively. We have all of the, the imaging there, and some of the tools to, medically to reverse the symptoms and onset of a stroke when it's happening if we catch it early enough. There's also, we also work in conjunction with some of the other hospitals for what I talked about, which are some of those endovascular type of procedures that that we may afford the patients who can benefit from that if they require something a little bit more in depth.
Yeah. Long term, does somebody who has suffered a stroke already, does someone stand a higher risk of having another stroke? And if that is the case, then what are the steps that they should be monitoring among themselves? Are there things they can do, checkups, periodic checkups, those sorts of things that can help them study those risk factors a little more in depth?
So lifestyle would be the number one thing you can do. I talk about quitting smoking. I also, one of the things that I've come to find in practicing is that for a lot of people, if they feel fine, they don't necessarily feel like anything is wrong. So they say, I had a stroke, but I feel fine now. Stop taking the medication. But by the time you feel something, a lot of times, the cat's already out of the bag. So it's very important to just, medication compliance, and treatment compliance, I would say, is one of the number one things you could do moving forward.
Is high blood pressure a part of this factor as well?
Yes, 100%.
Yeah, and so steps to control your high blood pressure obviously would be a big part of prevention when it comes to stroke. All of those symptoms, and yet some people are going to suffer the stroke. They're going to have some devastating effects. Death is definitely a possibility, and long-term paralysis can be for others as well. And we're aware of that, and we know of that, but it doesn't mean that because maybe your abilities have suffered that you have no quality of life. People can still function and have a very high quality of life having suffered a stroke and its more devastating effects.
Yeah, so there are differing degrees of disability that you may experience after a stroke. Some people have, like when we talk about the mini strokes, you have, complete reversal of symptoms. Some people have, improvement and restoration of function within, several weeks and things like that. So what is of utmost importance is if you do have a stroke is then what is the next step? You may have some facial weakness. You may have some difficulty swallowing or chewing. You may have some weakness in, one of the limbs or a side of your body. And that's kind of where I come in terms of rehabilitation. So I, in conjunction with Dr. Shetty, run the RCC, which is the Rehab Care Center at IRMC. And we see patients for a number of different maladies, but one of the main ones is stroke. And so we work on, now that you have a stroke and you have, let's say, arm weakness or leg weakness, or how do we get you walking again? How do we get you to dress? How do we get you to feed yourself? All the way to how do we get you back to work? How do we get you to fulfill some of the roles that you have in your life, such as, mother, father, son, daughter, and participate actively and have a complete life.
And where age is certainly a factor, that doesn't mean that young folks are not susceptible to stroke. We hear of that all the time, don't we?
Mm-hmm. Yes.
Yeah, younger people can have strokes as well, and with a longer life presumably ahead of them, getting the treatments and getting to you, Dr. Shetty, is very important.
And so one of the things is, this is why I keep kind of plugging general wellness and health and not waiting until something happens. Sometimes people have a family history of some of these things. You find out that for whatever reason, everybody in your family, had a stroke around 30 or 40 or something like that. That's something that needs to be investigated and looked at. And so if you're following up with a physician, they would be keeping an eye on that and doing the appropriate workup to figure out why, and if you need to be on any particular treatment to prevent strokes in younger people. We can do everything we can to prevent this from happening.
Can strokes be one of those genetic types of things that are passed down from generation to generation?
It's the stroke itself. Not what I want to say is there are certain disorders out there that have to do with clotting. Sometimes that can predispose you to strokes and other things that are sequelae or the result of being having an overability to clot.
So those genetic factors,
those things can be passed down.
Can lead to that, or can lead to some other medical problem that is
correct.
So someone wants to get in touch with you, or maybe start working with you and Dr. Shetty. What do they have to do?
They could call our IRMC call center. I will evaluate and see patients on an outpatient basis. We're just the general number for IRMC to kind of get in is 724-357-7000. And
the IRMC physician group number, which is 888-452-IRMC. That's going to get you there as well.
Yep.
Wonderful. Hey, thanks for coming in this morning. We appreciate that.
No problemo.
And we're going to get you to do some beatbox for us too next time. Okay?
Awesome.
He's Dr. Lanvin Taylor. We're glad he's been with us here today. Stroke Awareness Month, very, very important topic. And obviously, as you've heard from him, it's something that you need to be aware of and that you need to get treatment for if you feel that one is occurring. Thanks again.